What is being done, Dr. Desmo, to address the outcome disparities between black and white? And even better, if you can give an example of what University of Utah is doing. So just generally, and then what is U of U Health doing to address this?
So, one big initiative is making sure that hospitals are providing a certain level in terms of quality of care across the board. There's good evidence that, depending on where you deliver, which hospital system you deliver in, your risk of having morbidity or even mortality as it relates to your pregnancy can be higher. And that's been highlighted in Black community as well. So in predominantly Black serving hospitals, the rates of morbidity and mortality in some of them have been shown to be higher. So one big push is to kind of equalize care across the board. And one way that's being done is through what's called care bundling. So if you have a certain condition, there's just a certain protocol in place to follow, a protocol that is kind of nationally standardized, that doesn't really allow room for potential implicit biases, in hopes to optimize the available resources and just make things standard across the board so there's not just significant disparities or discrepancies between hospitals.
So hospitals and health systems can take I guess, a lion's share of this effort because that's where the majority of deliveries are still occurring as opposed to at home or a birthing center. How can a midwife help to address this disparity between Black and white as part of the care team?
I think a midwife can address this by receiving implicit bias training themselves, being educated about what's happening in our communities, being educated about this historical racial history that we have in this country, and look within and identify things that maybe they're holding within themselves that they're not aware of, and make sure that they provide equal care to all of their patients.